Symptoms in ascites. There is accumulation of water in the peritoneal cavity that produces pressure effect over all the underlying organs. It also affects the lung capacity, function of the lungs, and there is dyspnea, cardiorespiratory embarrassment, abdominal pain, abdominal distension, difficulty in swallowing, difficulty in coughing, walking, painful abdominal conditions, tenderness, and there is other symptoms that is called as the respiratory distress or the shortness of the respiration, breathlessness. In addition, there are other symptoms when there is portal hypertension, there is hemorrhoids, melena, hematemesis, and leg swelling. These are the various symptoms found in the ascites according to the amount of the fluid accumulated in the peritoneal cavity. Now the investigation. When it is not evident on observation, it is not clear, there is no distension, evident distension of the abdominal cavity, of the abdominal wall, the amount of the fluid is less than 50 ml, then we have to start with the CT scan. Then we perform the CT scan. When the amount of the fluid reaches above 150 ml, then we can perform abdominal ultrasonography and we can also detect the amount of the fluid in the peritoneal cavity and all the abdominal viscera located in the abdominal cavity. When the amount of the fluid exceeds 1 liter, then it is evident from observation, and also there is a percussion test that is called as shifting dullness. When the patient from prone position is transferred to the later position, the fluid that gushes or the accumulate to that side. So there is a tenderness as well as dullness on percussion. The note on percussion is dull due to shifting of the fluid. Next, when the amount of the fluid in the peritoneal cavity exceeds 2 liters and more than 2 liters, then there is also called as shifting. In addition to shifting dullness, which is positive, there is also a called as the fluid thrill. Fluid thrill are the when we tape the abdominal wall, the fluid thrill are the waves that is transmitted to the opposite side of the abdomen. You can feel by your hand placed on the opposite side. This is called as fluid thrill. In addition, because there is pressure effect on the umbilicus, so this is a shifting of the umbilicus that is called as smiling horizontal umbilicus due to the pressure, downward pressure of the fluid accumulated in the abdominal peritoneal cavity. So these are the various investigation or the tests which can be performed. And there is, in addition, there is also a test which is called as puddle test. Puddle test is always positive when the accumulated fluid is above 150 ml. So these are the various investigation which we have to perform to detect or confirm the amount of the fluid in the peritoneal cavity.